everyone, welcome back to my channel. Today we'll be discussing extremity fracture in a child. Let's ride on. Fracture is a break in the continuity of a bone. It could be as a result of twisting, trauma to the extremity, or bone decalcification. Fractures in infancy are rare, and when they occur, they warrant further investigation to rule out the possibility of child abuse or to identify a bone structure defect. Causes of fracture in children: trauma, bone disease that could be congenital, bone tumors, increased mobility, and there is also inadequate motor or cognitive skills. Assessment: there is pain or tenderness over the affected area. There is obvious deformity. There is edema or swelling. There is ecchymosis, that is discoloration of the skin as a result of bleeding underneath the skin. There is muscle spasm, loss of function of the affected extremity. There is crepitation, the sound that you hear when two bone surfaces are rubbing against each other. Now, nurses, let us discuss our nursing actions. The first action is to assess the extent of the injury, and you assess by using your 5 P's. If a child sustains a fracture, the extent of the injury is immediately assessed using the 5 P's. 1. Pain and point of tenderness. Which area is it tender to touch? Number 2. Pulses distal to the fracture site. Check for pulses that are distal to the fracture site. Number 3. Pallor or paleness of the fractured area. Number 4. Parasthesia. Check for sensation at the area distal to the fracture site. Number 5. Paralysis. Check for movement in the area distal to the fracture site. Those are the 5 P's that you can use for a quick and immediate assessment. And then, after the assessment, immobilize the fractured extremity. If a compound fracture exists or an open wound, cover the wound with a sterile dressing. If a sterile dressing is not available, use a clean dressing. You cover the wound to prevent infection or to reduce the risk of infection. Elevate the injured extremity. You elevate the injured extremity to reduce swelling or edema. Apply cold to the fractured area. Cold will assist in reducing the swelling, and also it will assist in reducing pain. Continue to monitor the neurovascular status of the child and then transfer to a nearest emergency department. Thank you very much for watching. See you in my next video.